The Philippines is expected to receive over 5 million doses of COVID-19 shots by February. Vaccine czar Carlito Galvez Jr. says the supply will come from Pfizer and AstraZeneca. UP OCTA explains that the impact of vaccines will primarily depend on the distribution. According to the group, slow rollout will just keep the country's pandemic situation on status quo. Now, as we wait for the shots, our COVID-19 caseload has breached the 525,000 mark with 2,000 new cases. The Health Department, however, adds over 11,600 survivors under its mass recovery program. As for the new variant, the DOH admits global shortage of gene sequencing reagents, but the agency assures the public that more samples will be examined in the coming weeks. And a team led by the World Health Organization continues to trace the origin of COVID-19. This time, they visited a market in the Chinese city of Wuhan. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Riza Diaz. Let's begin our newscast with the country's vaccine czar saying at least 5.6 million vaccines will arrive in the country by next month. Secretary Carlito Galvez Jr. said the shots will come from developers Pfizer and AstraZeneca through the COVAX facility. According to Galvez, 117,000 doses will be provided by Pfizer, while around 5 to 9 million jabs are expected from AstraZeneca. He notes, however, that these numbers, as well as the projected arrival, are all indicative since it will depend on the global supply. The UP OCTA research team says the speed of vaccine rollout in the country will determine when daily COVID-19 cases will begin to drop. In an interview here on One News, UP OCTA's Guido David warns that slow vaccine distribution may cause the current COVID-19 situation in the country to remain the same. David notes, though, that the trend of COVID cases in the Philippines is still manageable as long as hospitals are not overwhelmed.
We don't really have to, reduce the number of cases to zero. We're just essentially waiting for the vaccine, and we're trying to prevent an outbreak from happening before the vaccine arrives.
David also says they respect the government's decision to place Cebu City under MGCQ this February despite the rise of infections in the city. According to the expert, they agree that the COVID-19 attack rate and hospital occupancy in Cebu City are still manageable. He admits, however, that the increasing trend of cases in the city is still a cause for concern.
Cebu City is averaging about 78 new cases per day, and that's already a lot. I mean, that's more than Manila is averaging per day. That's almost as high as what Quezon City is averaging per day, and Quezon City is a much bigger city compared to Cebu City.
To arrest the spread of COVID-19, pharmaceutical firms from around the world formulated their own vaccines. But are all vaccine or COVID-19 vaccines made the same way? And how will these differences affect the body? The details from Bloomberg Quick Take.
We know a lot about the mRNA technology where they just take that little snippet of the instructions, the recipe for how to produce the spike protein. Your body reads that, makes the spike protein. The Johnson & Johnson is a virus vector, so they take an adenovirus from a chimpanzee and they modify it a little bit so that when it comes into your body, you again can produce some of those spike proteins and your antibodies respond to that. So it's all about mounting this response to the specifically the spike protein. So we really need that antibody response here. And then Novavax is totally different. So it's a coronavirus protein plus soap bark tree plus moth cells in order to produce, it's very interesting, in order to produce the spike protein that then your body again responds to. So the technologies are a little bit different in essentially how your body receives or makes, or both, the spike protein. And then, of course, all of that spike protein is there for the number one reason, which is to get your body to mount an antibody response.
When we think about vaccines that have been in use for years, do the vaccines from Johnson & Johnson and Novavax, do they more closely represent or more similar to vaccines that have been used for years versus the mRNA vaccines from Pfizer and Moderna, which we know until now have never been used in humans before?
So viral vector vaccines like the Johnson & Johnson vaccine, they have been used before. And actually Johnson & Johnson specifically had an adenovirus vector vaccine produced for the Ebola crisis. So this is not brand spanking new technology the way kind of mRNA in terms of coming to market was. Novavax is definitely different and new. I think one of the things that we can't underestimate here is just what this pandemic is doing for science. I come from the field of HIV. HIV revolutionized the way that we understood the immune system. And I think coronavirus is revolutionizing the way we make vaccines. I think one of the other points about the variants and how quickly things are changing is that we need vaccines that can be a bit more nimble. The mRNA vaccines will probably be the first to be able to kind of pivot and create a vaccine that becomes even more effective and efficacious against mutations and changes, variants here that we're seeing in coronavirus. But it's all to be seen. I mean, this is happening in such real time. It's amazing.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The country's COVID-19 caseload has breached the 525,000 mark. This after the health department reported more than 2,000 new infections, bringing the active case count to over 27,000. The virus claimed the lives of 80 more patients in the past 24 hours, bringing the country's death toll to more than 10,700. Coronavirus survivors, meanwhile, surged to above 487,000 after the DOH recorded over 11,600 new recoveries. The Health Department says the Philippine Genome Center will be reverting back to its standard testing of 750 specimens by next week. Speaking to us this afternoon, Health Undersecretary Maria Rosario Vergeire explained that the latest batch tested only 48 samples due to a global shortage of reagents. The B117 variant was not detected in any of these samples. Vergeire said they are expecting more reagents to arrive by next week, allowing the PGC to process about 750 specimens per week.
because of this global shortage, we're not able to get on time the procurement for these reagents. But this coming week, we are going to receive the procurement already, so we can be back to process 750.
The coronavirus continues to mutate in several countries, just as more people from around the world are receiving vaccines. How are these new COVID-19 variants changing the face of the pandemic? Let's find out in this report from Bloomberg Surveillance.
Yeah, I think that's going to be a continuing problem. It's completely understandable that so many people want to get the vaccine, and countries are thinking about their own populations and trying to prioritize those for vaccinations. But it's important to also understand this is a global pandemic, and what we've seen with some of the variants that are emerging is anywhere that the virus is replicating unchecked sets up a situation where the virus can mutate and change and evolve, and perhaps get around more of these vaccine-induced immunity. So we have to keep an eye to the global pandemic and realize that it's to all of our benefits to knock down virus replication across all countries and not leave areas where the virus can smolder and mutate and change and perhaps render our vaccines less useful.
So, Andrew, what are the vaccines that are now useful? There's Novavax, the Prime Minister of the UK yesterday saying this was great results. Does it work against the South African variant?
Yeah, so the Novavax press release came out yesterday. It appears that the vaccine has very good efficacy, around 80+% in the UK. The study was also done in South Africa, where we have one of these variants circulating that appears to be a little less sensitive to the vaccine. So there the efficacy went down to about 50%. Now that's still good. That still tells you that the vaccine is generating an immune response that recognizes this variant, and that South African variant is really the one that scientists are most concerned about. So I think it's good news, but it is a warning sign that says the virus is starting to change, and we need to increase our efforts at following the virus and tracking it and updating the vaccines when appropriate.
So, Andrew, could we be in a situation much like the flu where we need to get a new vaccine shot every year? And given what we know, the science behind it, would we be able to do that?
So it's a little too early to say whether this is going to look like influenza. I would tend to think that we're not going to be in that same situation as we are with influenza. This virus replicates or mutates at a much slower rate than viruses like influenza. It's also not clear how many more mutations this virus can handle. Influenza can handle a lot of mutations. The coronaviruses, it's not clear whether they can handle a lot of mutations. So it's early, and we can't predict that. I will say that most of the vaccines are generating stronger immune responses than our flu vaccines, so I'm hopeful that we won't be in a situation where we'll have to update the vaccine and initiate vaccination campaigns on an annual basis.
A World Health Organization-led team visited the Baisha Zoo market in Wuhan, China, to trace the origins of COVID-19. Today marks the third day of field visits for the team, who is also planning to visit labs, more markets, and hospitals during their two-week probe in Wuhan. The team has so far visited 2 hospitals which were at the center of the early outbreak of the COVID-19 pandemic. The investigation, however, has been plagued by delays amid concerns over access and terms of visit. The WHO said team members would be limited to visits organized by their Chinese hosts and would not have any contact with community members due to health restrictions. For more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.